Hello, we are the Elephant Group, and our presentation today will be focusing on our client Laura. Within this presentation, we are going to be identifying 3 barriers to communication within Laura's case, and also finding a solution for each of them to aid in Laura's recovery. The first barrier that was identified in our client's case was the fact that both her dietitian and her general practitioner were not in contact with each other about her status. This made Laura feel a bit lost about the status of her health and her progress she is making.
It is important that interprofessional team members have regular team meetings in order to facilitate effective communications. An interprofessional team meeting would allow each member to share their treatment process, plans, raise concerns, discuss potential feedback from Laura, and make appropriate referrals if needed. For example, in this particular scenario where there is clearly a lack of communication between the dietitian and GP, an interprofessional team meeting would allow the GP and dietitian to share their recommendations about breastfeeding.
Because of the lack of communication identified by Aman, Laura's dietitian and GP are giving her different advice, which leads to confusion and challenges for her as she juggles both. Her GP's advice, and her midwife's, focuses on her breastfeeding and pregnancy. The first advice she was given when attempting to get pregnant was to lose weight, because they assumed that her weight is a sign of poor health. Her dietitian, on the other hand, focuses mostly on her career in powerlifting and works closely with the health team members at the gym. Ensuring that her diet is appropriate for her work is their primary concern, and her weight is not then cast as ill health. Improving communication between the health professionals would be the first solution to take. Through this, they could ensure that their roles are clear, but they are not giving her competing information. Secondly, communication could help to provide clarity for the GP and the midwife around how weight and BMI is not in itself a sign of ill health, but why it is beneficial for some professional athletes to have a higher BMI and ultimately reduce the automatic assumptions about weight and health.
The third barrier for Laura's case is that she was unsure if she had the responsibility to keep the health providers updated with her current treatment plans. For instance, her lactation consultant might have given new suggestions, but this information was often not shared with other professionals timely. And the solution for this is similar to what Renee has suggested, to have interprofessional meetings to facilitate effective communication. A better patient expectation could have been made if an electronic communication system was there to show the progress, remarks, and referral dates for all Laura's treatment. According to a guide released by the Australian Medical Association, it encourages all health providers from all states and territories to share and improve communication across the whole country.
Overall, the 3 communication barriers identified could be resolved via interprofessional team meetings between Laura's healthcare team. This limits the confusion regarding conflicting advice and which information should be reported during her consultations, effectively adding to her patient experience.